Good morning. I'm Christian FANG from Hong Kong. Thanks, Ivan, for inviting me. So we have a very focused group this morning, I can see. Really focused. Are you residents or? Residents. Great. Can you come in front? So I'll just talk about how to prepare for the exam. It's just chatting. Well, I'll be asking these guys how they prepared for the exams. Apparently, they have all passed, and they have been through the residence year, which is very tough. Yeah. So there's so much to read during your residence day, and it's nearly impossible to really complete everything, right? And moreover, where are you going to start from? Where are you going to read? Are you going to read journals? Are you going to read textbook? Can I bring the mic and walk around? That's not allowed.
Because we actually have a video recorder. So
That's fine. So I just want to ask, Ivan, what do you like to read most when you're a resident? Nothing. You like sleeping the most.
Just like to
What about you? What do you like?
I would like to read something simple
Simple.
and conclusion, like review article.
Yeah.
To start off with.
All right. What about you guys? What do you like the most? Systematic reviews. Same. Textbooks? Do you read textbooks? All right. Now, there are different types of textbooks. So I go to Amazon, you just have a look. I'm an orthopedic surgeon. Are you a general surgeon? General surgeon. So you are less lucky than me because general surgery, you have 24,000 textbooks. Orthopedics, I have 8,000 to go through. These are all textbooks sold in Amazon. It's not a lot. I think if a few lifetimes given to you, you can go through all of these. So how to choose which textbook to go through? I mean, there's always a Bible kind of textbook. So for orthopedics at my days, that's my favorite. Ivan, is that yours too? Campbell's.
I have this in my cupboard.
Okay. Yeah, you barely even read it. We all buy this stuff, but we never read it. So for mine, there are 4 volumes this thick, and then it adds up to about a feet. A feet is around 10,000 pages. Can you go through them? What about surgery? I don't know. How does the textbooks in surgery look like? 2,000 to 3,000 pages. How many volumes do they come in? According to the books. So like general surgery. Are you focused on urology or maybe vascular surgery, something like that? Not yet. So if you are, you add on 2 more or 3 more. That's so unfortunate. So the guys who write these textbooks are experts, but experts are not, they don't know everything, okay? So it's their narrow-minded idea that goes into these textbooks, unfortunately. So actually, you know that the literature nowadays is so wide, and if you look at only textbooks, it's not possible to cover any single topic with a broad enough view. Nonetheless, these are good things for establishing the syllabus that what you need to know in your clinical practice. Now there are these, we call these chicken soup, chicken broth. These are what I like the most because it's shrunk down into 500 pages, 1-inch thick stuff. You can start reading these when you're on call, on duty. How many you all have these kind of books, right? These are probably your favorites. Now the problem with these books is they don't give you a very in-depth knowledge, but they give you a very wide syllabus as you are reading the thick textbook. And the great thing is you can bring this into the toilet because it's not so thick. You can put it behind your toilet seat and just trying to go. What do you like to read most when you're a resident days?
Well,
Oh, AAOS review articles. Okay.
Then this, I have this book.
And then you have this book. Which one? Miller? Do you have Miller or
Oh, well, the left one. I have both, but
both?
I like the left.
This one? Okay. This one, right? Orthopedic Secrets. I favored this one. I guess for surgeons, you have Surgery Secrets, right? And then urologists, Urology Secrets. They make a lot of money, but it's actually rubbish what they write inside, unfortunately. But the good thing about these, it's all in bullet points. So when an examiner or your senior comes up to ask you a question, you can recite all these bullet points. It will look very impressive, especially impressive to your junior doctors who know nothing. But actually, what I think is most beneficial for your clinical care and for patient and for practice are the scientific journals, because these are the only things that go through peer review. It's rigorous. There are at least 3 established people looking at each of this journal. The unfortunate thing is, you look at the publication numbers, it's going up exponentially, and then also makes it near impossible to cover all of these. So going through the review articles is a good way, but even the review articles themselves, there are just too many of them, right? Now, when you look at a paper, the structure of a paper, how do you read them? Can I ask a resident here? Do you read all of these points? Now, the paper is structured in background, methodology, results, discussion, figure, tables, references. The most useful stuff in any article as a resident, there are only 2. It's the background and the discussion. You can skip all the other stuff because it's not so relevant to your clinical practice. These are 2 focus. However, the background and the discussion is really usually well thought out, well written, and it summarizes correctly what this article is about. For example, here, that's a very long paper, 7 pages. But if I just focus on the introduction, the discussion, it's about 2 pages to go through, and you're reading the cream of the cream in every instance. So I don't really care whether it's a review article or just a scientific publication. So I just randomly go through these, and then I think it's quite worthwhile and time-saving to do this. It summarizes things quickly, and it's usually easy to go through. What about you? Do you read journals this way when you were a resident?
Just go for abstracts.
Abstracts. Oh, it's even easier if you go for abstracts. But do you find it too focused on a topic when you go through the abstracts?
I think abstracts, most of them should be quite well written.
Mm-hmm.
So they provide a snapshot of the quality of the journal. But when we go in depth, we read the whole journal, we find that actually this is trash.
Yeah, the abstracts is a great way, but only read great papers, then they have great abstracts. If you have a low-level journal, the abstracts are usually also, unfortunately, going to be lower level. There are so many online websites nowadays. For orthopedics, these are the few. In my days when I was studying as a resident, they are free of charge. Now, because it's realized they are so useful, they are usually charged. So you pay this little fee, and then you log in. You can always go through your stuff when you're on the bus, when you're in the toilet, when you're on call, whatever you're doing. Now, the great thing about these websites, are you using these websites? I bet on surgery and whatever specialty, there are quite a few. The great thing is they usually have questions in the sites. They have quiz, they have multiple choice questions, they have picture quiz, you can go through them, and then all these are given with model answers and relevant references. So you can have a self-assessment easily through these. It's almost like reading a textbook, so I don't really buy textbooks anymore. If I tell my residents, just use these websites. It saves you money, it saves you time. You don't have to bring the thick thing around anymore. It saves your covered space at your home. Your wife won't complain that much. And the way I review my stuff is I also get PowerPoint files, PowerPoint slides from whatever talks I come through. The experts, not like experts giving a talk, you go to them, can I have your PowerPoint file? And then you later come back to these files. It's actually very useful. It's not about going through all the content. You just run through the file, look at the images in all these files, and then try to comment on them. It's a training for your mindset, for your logical thinking. It's especially good if you train this together with one or two of your colleagues. Try and comment on these x-rays. Now that's a tibial plateau fracture. I can see a joint depression here. This is whatever classification, whatever type. My treatment is going to be like this and that. The problem of this fracture, it's difficult to reuse, it's difficult to treat. There may be compartments. So training through this mindset will actually train up your clinical approach to this situation. PowerPoint files or even textbooks, the most useful part of them are all the diagrams and the pictures. So I suggest an easy way is to go through the pictures, just the pictures, not the text, and try and explain it. If you are able to do so, probably you already know enough on that topic. So all these now remember to save a lot of time reading what you're really interested in, because reading this is what will make you stay awake. When you read something that is not interesting, I always fall asleep. If you're interested in engineering, yeah, read it. Statistics, yeah. Social science, even cooking. Now, yesterday they talked about cooking, how to bake a cake, or even novels, fictions. I think these are worthwhile to read, perhaps more worthwhile than textbooks or journals, because it keeps your mindset open. This logical thinking is most important in clinical care. It is not the knowledge itself. So broadening your mind will lead you to a very logical mindset. And I think this is very important. This always happens. Now, in a surgical residency training, you always have complications. Sometimes the complications are blamed on your seniors. Now, my senior told me to put this nail in like this and put the screw in like this. The screw ended up penetrating the hip joint, so the hip joint is destroyed. Now, the patient needs a hip replacement. If you know about orthopedic training. In surgery, maybe the senior surgeon taught you to suture the bowels like this and that. Unfortunately, there was an anastomotic leak afterwards. Okay, that's hell. Now, every of these incidents of bad luck or mishappening is actually a great chance for learning. It's a very good chance, because this will drive you to read up about the technique, read up about how to improve, read up about how to prevent further mishaps. And I think reading before and after these things happening, you will always remember the knowledge you gained for a lifetime. So this is how I learn. Every time unfortunate things come in, this is actually the best chance for you to learn. Learn from yourself's mistake, learn from other people's mistake. Now, before the examination, your reading pattern will be very different from what you read after the examination. Now, that's just for myself. I don't know if it applies to them, to you, but for myself, during my residence day, I spend most of the time reading journals and my own interests, which is non-medical stuff, not related to medicine at all. And then I divide half of the remaining time reading some textbooks and reading other people's PowerPoint slides. So I actually don't spend a lot of time doing textbooks most of the time, because it's just too boring, it's just too thick. You can't just read that and stay awake. It's impossible. Now, I read that when I want to fall asleep. just before my bedtime, if I have insomnia, I'll open up the textbook. It's a really good way to put you to sleep. And journals, I read this whenever I have a clinical scenario that needs information, or I had a mishap or a complication. Then I go to the journals and try and improve myself. I find that this is the most efficient way to retain the knowledge, rather than just going through the textbook step by step, trying to highlighting, and nothing ever stays in your mind. When you're near the exam, the reading pattern changes. So because revising for exam is really tough, okay? Exams are a necessary evil, so unfortunate. They're expensive. You don't want to do it twice. You want to do it once. If you fail, all the preparatory work, all the exam fees go to trash. It's as much as buying a new car, another car in Hong Kong. So here, I will usually do the textbook when it's a year before the exam. Now, going through the textbooks is not really about trying to retain all the knowledge inside. It's trying to cover the syllabus, see what you have missed out over the past many years. If there's an important topic which you have missed out, here, when you go through the textbook, you'll realize this is your knowledge gap, and you'll focus more on this. Now, PowerPoint slides, as I mentioned, that's how you train your, how you comment on things, how you comment on x-rays, how you clinically approach a scenario. So slides and pictures are the most important, as well as textbooks, just before the exam. So, of course, you won't be spending much time reading your own interests. And journals, there's no more time to do that, just before the exam. After the exam, okay, so this is the best time of your life, supposed to be. You won't be reading any textbooks. You'll throw away your textbooks at home. These are no longer necessary. You give them all to your trainee residents as gifts. Or if your girlfriend is a trainee, give it to him, give it to her, all right? And then you spend most of the time reading journals. This is where the real scientific data will come from. PowerPoint slides, you keep them in your computer just in case, but you don't really need to read them anymore. So yeah, this is my suggestion. In fact, forming a study group is very important when you're a resident. There will be always gaps in your knowledge, something you have left, something you have never thought of, something you're uninterested in, and you have always some topics in your mind that you are an expert in. The way the study group works is one person here, she is an expert in, let's say, small bowel anastomosis. This lady next to her, she is an expert in dissecting lymph nodes, let's say. This next to her, he is an expert in how to, I don't know nothing about surgery, so how to deal with blood vessels, for example. So they will be asking questions between each other, and each time you do that, you actually learn a lot from your pair. And it saves you a lot of time because you don't need to revise anything, and you are directly getting knowledge from your friend who is an expert on that topic. So the study group, everyone prepares what they are interested the most, and most prepared, they ask questions to the other people. And in return, the other people ask questions and give you the answers. So that's a very effective and efficient way in learning without needing to read much. So study groups, you can do it in the library, of course. Typically, my way of doing study group is I usually book a private pool villa hotel. There are lots of these in Southeast Asia and Thailand, like your place, or Singapore, Bintan, just next door. So it uses a little bit of money, but I'll say that if 4 or 5 of you share one of these 3 days, it's not as expensive. It's bearable. And you can all do the study group within the pool, which is very good. I think that's another one. I think this is a 3-bedroom private pool villa. The best trick about doing this is you prepare some place where there's nothing to do, only the pool villa. So trap yourself inside here, do nothing else. Don't go out to beaches. Don't go out to activities. Just stay here for 3 days. After that, you find that your knowledge level actually increases exponentially. And the worst thing is, after your examination, so this was me. I was so fortunate, I got a gold medal in my examination studying this way. So you will miss your examination, and you will be feeling that it's so unfortunate. You'll never be able to do this residency again. You'll never be able to study like this again in your life. So do love your residency. Try and make the best out of it. Try and enjoy it while reading. So that's my talk. Thank you.